This is Healthcare Now Radio's Trending Now. Get ready for an exhilarating 30-minute ride through the latest topics driving change in digital health across the news and social media. Join us as our subject matter host takes the lead in uncovering what's hot and what's not. So buckle up and tune in to stay in the know.
Welcome to Trending Now on Healthcare Now Radio, where we explore the forefront of healthcare innovations and transformations. I'm your host, Shahid Shah. Today, we're thrilled to have Jacob Hansen, Chief Product Officer at AvaSure. What's trending now, and what Jacob and I will discuss, is the hospital of the future and the transformative outlook of AI-powered virtual care. So you're going to have a great time. Join us as we dive into how alternative care delivery models, AI, cutting-edge collaborations are shaping the future of healthcare and addressing really important pressing challenges like staffing shortages and rising patient complexity. Hi, Jacob. Thanks for joining us. Can you tell us a little bit about AvaSure yourself and your role at AvaSure?
Yeah. Thank you so much for having me, Shahid. I really appreciate it. Excited to be here chatting with you. Chief Product Officer at AvaSure. I've been here now a couple of years, and I love being a part of the team there. I love our value proposition and just the chance to work on something that's playing such an important role in the changes happening in healthcare. A bit about the background of AvaSure. We're an intelligent virtual care platform that facilitates bringing remote caregivers to the bedside, whether it's for continuous monitoring or consultative interactions, and then also allowing augmentation and automation of some things through the use of artificial intelligence, all of that through a hybrid of hardware and software solutions that make all of that happen. So we work with over 1,100 hospitals around the United States. And just thrilled to be here meeting with you.
No, it's great that you guys have so much real world experience, which is why I'd first love to start and talk a little bit more about people saying the word transformation and what that really means in the AI world. So let's start with the human element. We all, I think, generally believe that AI will in many forms take over, but there's this part of healthcare being super human focused. And that is, in a world of AI and virtual care, when it does take center stage, what happens to that trust between patients and human caregivers and your experience at AvaSure?
Yeah, great question. I think the real important thing, and this is something we talk about often at AvaSure, is the role that AI can play in particular in supporting staff and the way they can focus on patients. And that can really happen in two different ways. One is augmentation of a care team member, and then the other is automating more operational tasks. But when you think about the human element, you've got the human element for the experience of the caregiver, and then the human element for the patient as well. On the care team member side, the human element of that is enabling them to play a role in the care, the parts of care that they're trained to deliver on, actual patient care. So if that means that we can use AI, for example, to attune a remote observer or safety attendant's eyes to the right patient at the right time, or to automatically make sure somebody's getting notified that attention's needed in a specific place or at a specific time, right? We're not aiming to take away their opportunity to do what they love and to support patients, but instead to make sure they can be at the right place at the right time. Because we all know there are plenty of cases where there's so much going on for so few staff members who are even in a position to help that they aren't able to do that at times. So that's really our focus, is on the difference between automation and augmentation and how that affects exactly what a caregiver does.
Yeah, what I love about that direction that you guys have taken is the word augmenting is super important, because we're not looking to erode the idea that healthcare providers who are human are the most important part of that experience. First, the most important part is the patient. The second most important part, of course, is how are the humans taking care of that? And what I'm hearing a lot about in the industry, both as a software engineer as well as being in healthcare for a long time, is where can we take humans out of the loop? And the way that you put it is, where can we take humans out of the loop where they can be more effective, not where can we take more humans out of the loop so things can be cheaper, right?
Yep.
So talk about that distinction.
It's keeping humans in the loop in the places where having them in the loop is so critical. And there are some operational situations where a caregiver is probably frustrated that they're distracted from what they are doing to go take care of a thing. So, an example might be that a care team member has to go check in with a patient on a round when the patient was actually resting and sleeping, or something with monitoring patient turns, or there's a variety of these. Something else might be with early mobility, as an example, right? Has a patient moved adequately to prepare for discharge? These are things that we can at least have computer vision AI engaged in observing what's happening in a room to empower the care team members available with information so that they can engage in the places where it makes the most difference at the right time. Obviously, we want to use these tools to support things like proactive rounding on the right increments, and also addressing the right patient needs at the right time. So that's really what it's all about, is putting people in the right places. And there will always be some settings where I think a big part of this ties into education. I'm sure you talk about this a lot too. Making sure that care team members know when we bring AI into this mix of what an alternative care delivery model looks like, we're doing that not to displace, not to limit, not to remove. It's just about empowerment through automating and augmenting in the right places.
Yeah, that's a great explanation. And, often when my parents ask, or my elder aunts and uncles ask, and they're like, what the heck are you guys talking about when you say AI is going to augment or replace these humans? And what I try to explain to them is, imagine that you had an unlimited source of, quote, free interns available. These interns, they're not super experienced, but they know the world. They've already studied everything. They know everything. Now imagine you could pick one intern to stand inside a hospital room. So this intern knows what's going on. They can see things, they can understand things, and they can tell you, hey, the patient's not turning in his bed every so often. Hey, the patient got up and fell down. Hey, now they don't do the care. But imagine that you had these unlimited interns sitting in every room, and whenever anything happened, they alerted you so that you didn't have to go to every room, so that you didn't have to go study everything. And so once we think of them that way, as almost an unlimited number of interns that were super, super smart, like not interns that don't know what they're doing, but super smart interns that will do exactly what you tell them to do, no more and no little, but they do inform you, they tell you what's going on. And once people understand, oh, so that's what augment means. Just like if you imagine you could hire unlimited staff, you just augment yourself. But the problem is when you hire unlimited staff, you have to train those staff. You have to get them up to speed. They have to work on your culture. You have to make sure that they're available all the time and they don't get tired. Well, imagine a whole bank of interns that never get tired, always do exactly what you tell them to do, and will never miss a beat when they need to inform you about something. Does that sound about right as what AvaSure is doing?
Yeah, and so I agree with everything you said. And I think one of the interesting things about AI is that it's just the promise of AI is about scaling the benefit of virtual care even farther than it already delivers today. Let's take you used a great example around falls a moment ago. So for a long time, virtual sitting was all about taking a thing that was a one-to-one exercise, a human being that would go sit somewhat awkwardly in a patient room with a patient to make sure that they didn't fall. I actually was a falls risk patient as a teenager a couple of times in a hospital. And it was a little strange having somebody sitting in there. And it's also expensive to the hospital, to the health system. Virtual sitting takes that one-to-one thing, and now it's 1 to 16, or 1 to 12, 1 to 16, based on best practices. But a single virtual safety attendant can now watch some number of patients, and they can watch them for falls risk, or elopement risk, or contraband risk, suicide ideation, these different things. So AI takes that very clear, hard ROI, something that costs $25 an hour, down to now potentially $2 an hour. And now it can take that and stretch it even further. Why? Because now that same safety attendant, let's say they're watching all falls risk patients at 9 p.m. in the evening. Well, now they could probably expand that number from 12 to 16 to some number well beyond that. Maybe it's 3x the number of patients, because everybody's starting to go to sleep. They're not moving much, and they're not supposed to be getting out of bed. Right now, I can just be eyes on with a lot more patients. So AI is about taking the benefit of virtual care and it's just scaling it that much further.
Love it. Yeah. If you're just tuning in, you're listening to Healthcare Now Radio. This is Trending Now. I'm Shahid Shah, and I'm talking to Jacob Hansen at AvaSure. We're discussing the hospital of the future, focusing on how AI-powered virtual care is transforming the healthcare landscape, particularly in tackling staffing shortages and improving patient outcomes. So you guys have just announced a partnership with Oracle and NVIDIA. Tell us a little bit about that. What is the virtual concierge, and what does that partnership look like?
Yeah, we're obviously thrilled to be collaborating with Oracle and NVIDIA. We've been a long time Oracle Cloud Infrastructure customer. Our AI models, particularly for computer vision, are hosted in OCI's infrastructure. So this is really an expansion of that partnership and just adding a collaboration with them and with NVIDIA together. And our focus at the outset with artificial intelligence has been heavily on computer vision. When you think about it, everybody wants to talk about AI, right? But there's a lot of flavors of AI. And talking about AI doesn't really have any value unless you get specific. So for us, that can be computer vision. It can be ambient listening, right? A microphone that's hearing something that's happening. Could be machine learning, looking at data and extracting intelligence from that data. So we started with computer vision. This announcement is all about our steps into ambient listening, but we also want to be really clear what it is and what it isn't, right? There are companies out there doing things like physician and nursing documentation, digital scribe, heavy focus on clinical language. That's not what we do, right? We're not going to be focused on that. For us, it's about triaging needs at the bedside through more operational or task-driven ambient listening. So you think about a caregiver that's at the bedside, they're gowned up, they've got hands in gloves, they might be doing something with like changing the dressing on a wound. Maybe they need a second pair of hands. Maybe they need to consult with a senior critical care nurse from a coaching and mentoring perspective. The ability to use a wake word, something like "Hey Ava," and then engage a triaging element to say, "Hey Ava, I need a second pair of hands in room 335 as I work to address this wound," or something like that. And then that virtual concierge has the ability to listen and say, okay, is this a clinical ask or something environmental? Are they asking for a pillow or ice chips or to make the room warmer? Or is this about a question about medication? And these could be questions or needs from the patient or from the bedside caregiver. And so for us, it's all about triaging, getting the right person to the right place, and taking some burden off. When you think about traditional calls outside of the room, a lot of those go to the nurses on the floor, right? Well, there's a lot of cases where we don't need to be bothering people at the nurses station in that unit. So how do we bring that virtual cast of characters from all over the health system to the right place? And I want to mention, one of the reasons we're so excited is NVIDIA and Oracle have given us the chance to collaborate with them on some of their newest GPUs and chips with the H200. And when you think about why that matters, this is all about improving the scale, reducing the latency, all the technical elements of what's limited AI in the past at times. The walls are coming down so fast because of how fast companies like Oracle and NVIDIA are moving. So now we can work with world-class, market-leading, innovative processing, and we can do that using their inferencing microservices in NVIDIA. We can bring all of that to bear with the context that we bring from healthcare to focus on real clear problems in the market that need to be solved. Hope that was kind of a long-winded explanation, but hope that helps.
It was very helpful. In fact, the more I look at Oracle these days, especially what you called OCI, the Oracle Cloud Infrastructure, I'm more and more impressed by it. In fact, just over the last couple of years, I've gotten my developer accounts, played with them. And what's different about them is everybody may recall that they purchased Cerner a few years ago. Mm-hmm. And so they are a horizontal, hyper-scaling capable system, but then has deep roots, like the guys with NVIDIA on the hardware side, with Oracle on their Exadata and other systems, plus the healthcare knowledge. Now adding in AvaSure's capabilities on top just creates a really, really strong partnership. So that's, very, very exciting. Now, I was very interested, you were talking about the virtual care model and the triaging. Now, this triaging looks like it's bringing in new actors into this patient care environment. you have a concept of arbitration, deciding who gets access to the patient and when. Now,
Yeah.
as AI factors into this process, where does arbitration, where does that fit, and how does that help?
Yeah, critical question. This notion of arbitration, boy, as a virtual care platform, we talk about this a lot. So when you think about it, the number of potential collisions between all of these virtual care team members that can come up is not it's not a small issue, right? You've got virtual safety attendants who might be continuously monitoring for things we talked about before. You could have remote critical care nurses who are monitoring for deterioration. You could have a rounding hospitalist who's interacting with the patients on a consultative basis, case managers who want to talk about plans for discharge or care transitions. You could have an RN doing discharges, somebody running patient education. All of these things involve some understanding of who gets access to the room, when, and why. Because if you think about a physical setting, nurse comes to the room, knock, knock, hey, patient so and so, I'm, Joe. I'd like to come in and talk to you about this, that, or the other thing. Is that okay? And then if somebody's already in the room, let's say Joe had come in and nurse was in the room doing something, Joe would automatically realize, oh, I need to come back, and they'll step away. We, as the platform, have to facilitate that type of interaction and to let somebody know who's in the room virtually, what are they doing there, and which thing that's happening has precedent, and then how do we queue up other needs, right? If somebody comes and checks in and they can't get access at the time, how does that queue up behind what's happening now? Or what if those things can happen at the same time? For example, what if you've got a continuous monitor watching for falls, you've got AI watching for operational task-oriented things, and a virtual nurse who's doing a consult with the patient? All three of those things can actually happen at the same time on the same video stream. But how do we give precedent to somebody who gets to control the camera for pan, tilt, or zoom, or who has control of the speaker? And then how does the other party that's still there and can see what's happening know that that's happening and be okay with it?
Yeah, no, these are perfect examples. And in fact, that's what we love for our audience to hear over and over again. AI is here, it's real, it's working, there's no question about that. But when you apply it in healthcare, there's a lot of complexities. And so from your experience in AvaSure, and maybe extending on what you just said, what challenges have you encountered when trying to integrate this into real world hospital settings beyond the just the access question, et cetera? Specifically, what are people not talking about? What's hard here that AvaSure has been able to see because of your 1,100 customers and how many times you've seen certain kinds of things? What are people not talking about that you can share with our audience?
Yeah, a few things there that I'd bring up. And I don't think it's that people aren't talking about it. I think that these are hard problems to solve.
Maybe
So
that's why they don't talk about them.
yeah, one of those items is privacy for the patient. If you've got various forms of AI running that are monitoring the room, whether it's by image or by voice, right? Computer vision or ambient listening. How do we extract intelligence by letting algorithms interrogate that video stream, but not capture PHI or not have a privacy issue? So, for example, on our end, we have a lot of work we've done around anonymization of the patient. Before, when we need to train models, right, we've got to do it without having any PHI captured. So this notion of anonymization to support privacy is critical. Another really complicated thing that's going to keep coming up ties to security. How much, depending on how well you can anonymize the data, what can leave the domain, health systems domain, and what needs to stay in their environment, especially as we see more, the proliferation of cloud infrastructure is really critical in that question. And then the last one I'd mention is there's always going to be an ongoing debate around AI processing at the edge versus centralized processing. The more centralized you are, the more you can learn from all these different deployments and train AI in a centralized model, as opposed to, say, processing at the edge. Now you have fewer concerns about latency, but when you're processing at the edge, how fast do you outstrip the processing power of that hardware you've just installed, right? Do we have health systems that are putting stuff in and 9 months later, now new models come to the market and this thing can't handle it? What do we do with the pace of change as Moore's law shrinks? right, goes from 18 months down to some other number, how do we adapt and have hardware that can handle that kind of change?
Yeah, the pace of change also leads me to ask the next question around the human ability to accept this pace of change. So hardware, we can understand that the new models might stretch hardware, and then you can replace the hardware pretty easily. But you can't replace humans very easily. What are you learning across your hundreds of customers about what is best in class in terms of that human computer interaction with AI from a training, education, perspective at the corporate site, meaning at the hospital itself, but maybe even extending for it to go back into medical school? What are you guys seeing and talking about what docs and nurses are being trained for as they leave school, and then what happens with AI training as they arrive at the hospital?
Boy, there's a lot to unpack in that question. I'll start with the fact that one thing I love about our approach, we will always think of ourselves at AvaSure as a clinical first, a clinically focused organization. Our value proposition is completely dedicated to clinical outcomes. So I will say that when you think about change management, this is just another layer on top of the changes we already had to deal with when it came to virtual care, right? In fact, it fits with what we said earlier, right? AI is just the scaling of virtual care workflows and methods. So when you think that way, we've already been thinking about and running change management programs for the last 15 years with virtual care. Now it's about iterating that education, that planning with people from AvaSure on site, with caregivers, shoulder to shoulder in monitoring and introducing and then monitoring and measuring the impact of the changes that we put in place through technology. So that's one thing I'd say is it's not totally new, right? Everybody had to get used to the idea of why is that like mobile cart with a camera in here? Is this a robot? What is it doing? Right. And then also getting used to I'm in this room and there's somebody else and I can talk to them and we can interact about what's been happening with this patient. Now it's just taking it yet another step further. And I think the most important part of that story is making sure that when we do introduce these AI elements, that staff actually feel supported to be where they need to be when they need to be there.
Yeah, that supporting of the staff, I think, is really the interesting part of the conversation, that over the next few years, you could imagine maybe by the end of this decade, there's going to be a lot more automated AI watching what humans are watching, whether it's the sitter, whether it's the camera, et cetera. What we're still all struggling with, I think, and this is where companies like AvaSure can certainly be helpful, is as you go back further and further into the training, the more we can teach. Like, for example, for many, many years, I've worked on nursing systems. So our job was to get rid of the nurses' paper and pad so they didn't have to take notes and slip them onto computers or put them onto an infusion pump and say, don't do this and don't do that, right? Remember all those silly things, little notes that happen everywhere. I think all of that will be taken care of over the next few years. You guys are going to handle significant portions of that. My big worry is whether or not humans are ready from the time that they enter into this new workforce to optimize that. So just as we have a couple of minutes left, tell me, as AI continues to evolve, where do you think all these most significant impacts will go over the next 5 or 10 years? And that'll conclude our interview here.
Yeah, just a couple quick thoughts. One is to your point, with making sure people feel ready for these types of changes. I will say another area we focus is on the way that standards boards are thinking about this. We have a chief clinical officer here who is as passionate about these outcomes as anybody I've ever worked with. I feel really blessed to work side by side with her. Her name's Elizabeth Vitruba, and she's on I think she just joined another board, the Medical Surgical Nurses Certification Board, focusing on what it means to be a certified acute virtual registered nurse. So with those types of standards, right, you end up with some clarity around best practices, what it means to be a virtual nurse. And the more standardization there is, the more clarity there is for everybody that's participating in these alternative care delivery models. So just wanted to share that as another way we see opportunities. And then, your other question, just with the last minute here, around where's it going, really from our perspective, you hate to say it this way, but there's almost no limits, right? The pace that we're moving at, every way that we can unburden humans who are doing the most important work in caring for a patient, the proliferation of the number of different kinds of computer vision models, the vast ability to train models around what it can listen for, the automation of interactions with patients about stuff that nobody should have to come to the room to do, right? It could be even something like letting them order and customize their food, right? And then checking that against dietary restrictions, checking that against medication, making sure that it comes to the room, monitoring how much of it they consumed. I mean, these are like little things, but they tie so much to the level of effort that humans have to put into anything other than how am I helping this patient get better?
No, that's a great way to conclude here. And in fact, the way we see things is a lot of us, you and I would be considered techno-optimists. So a lot of us as techno-optimists think that things will happen faster than they really do, but we always underestimate the total amount of change that will actually occur. And so as you think about that, for our listeners, do reach out to AvaSure and Jacob here. And thank you so much for joining us on Trending Now on Healthcare Now Radio for this engaging discussion. Stay tuned for more episodes where we explore the latest trends and innovations shaping healthcare's future. And I appreciate Jacob here for our current interview.
Thank you so much.